Patrick Kelly. I'm the Chief Technology Officer with MPOWERHealth, and I wanted to talk a little bit about the practice optimization dashboard that we've created here. So just a quick overview. We tried to identify the 9 most common performance metrics for any practice. You can see I have them laid out here. And what's nice about this is if you can understand one of these cards on the screen, you really understand how all of these cards work together. I'm going to focus in on appointments here for just a moment. You can see some very common metrics on here. So I've got month over month, which is going to be how I compare, in this case, September 2020 to August of 2020. You can see that I'm up 10.73%. But also, you can see year over year. So how does my September 2020 compare to September 2019? And I'm down 76%. And then to try to flatten out any kind of seasonality, you can see a 13-month trailing average, and you can see I'm also down 60% compared to my September 2020 to my 13-month trailing average. So a quick reference, you can see the rolling 12 months here. So you can take a look and see these points in times. How does it actually look on a graph? And up top on this bar, what we have is how we compare to a benchmark. So this benchmark happens to be 25%. More than your trailing 13-month average, but it could be anything. I'm going to investigate how am I down 76% year over year and 60% of 13-month trailing average. So if I go up to this title here, I can drill in, and what I'm going to do is I'm going to get to the first level of detail screen. Now again, like the first screen, any of those cards that you go to, be it charges, be it payments that are charges that are outstanding for more than 90 days, no-show rates, you're going to be taken to a second level drill down that is very similar to this screen here. They're different entities to each other. You compare across time. You're going to have a little simple pie chart. You're going to have a nice map to show, in this case, where appointments are coming from by city. But this could be where my charges coming from by city, where my payments coming from by city. And then down here, you'll have some sort of line graph, or in this case, it's a stacked area graph. So I can see where all my appointments are coming from. And again, if I'm looking here, I can see everything looks pretty flat except for this big blue one here. So that big blue one is the hospital 0007. It could be Methodist, could be a THR hospital, but I see that has trailed off significantly, and that is probably making for where the bulk of my appointments are, I'm losing them. I have facilities that are trending up compared to the 13-month average, and I have some that are trending down. This one here, I'm trending down 11%. These are all 100%, so I've lost them all together. But if I want to look specifically at this particular hospital, I can click on that particular facility. I can click on this one, and then everything gets responsive. So you can see the pie chart has changed. These are the appointments by city for that one particular facility. These are, now I'm just filtered now just to that MPOWERHealth facility 31, which is what I selected up top here. Then come down, and I can see that the only thing I have highlighted here that's actionable is this particular facility. I could come in here and I could filter by practice facility 31, and I could group it by providers. And now what I'm seeing are the providers, and I can look to see if there's a particular provider. In this case, I can see I have 3 providers, Dr. Aubrey, Dr. Spencer, and Dr. Caden, and they all have left the practice, probably is what's going on. Because the 2 providers who are still there, I can tell they're still there because I have selected period that has data in it, they're actually going up. So the providers that are left are actually trending up. My overall metrics are trending down based specifically on the providers that have left the facility. The other interesting thing that I can do is down here, I can look at no-show rates, and I can see that no-shows on purple, so I actually have pretty good no-show rates, but I'm looking at my overall statuses. The bulk are acknowledged, bumped, I can see canceled as orange, but my no-show rates are actually pretty good in this purple area over here. I wanted to come in here and investigate specifically facility 031 at the patient level. I could come in, I could select this, and I could go over here and click this drill down button. And what's going to happen now is I'm going to get to the patient level detail. All these records here are specifically for that facility that I just clicked into. You can tell because they're all facility 31. You can see the name of the patients, when they had their appointment. I can see the status of the appointment, the type of the appointment, the provider with which the appointment was to have been had, But I can also come in here and I can see what cities are these coming from. I can zoom in a little bit if I want to. And if I really was interested, I can come zoom a little bit more, and I could come in and I could actually click on one of these and filter down above to where now I'm just looking at the appointments that I have for the patients for whatever I just clicked on. So in this way, I can actually see where my appointments are coming from. Could be an interesting exercise if you're looking to stand up another practice, another facility, another location, maybe purchase another facility somewhere, so you can actually see where your volume is coming from. And we're going to look at denial rates here for just a minute, because it's a little bit different than the appointments. The card reads exactly the same way. So to the extent that you could read the appointments card, you can also see you have month over month, year over year, 13-month trailing average. I'm being benchmarked over here. A nice tooltip to show you what's going on. I can look at my trends down at the bottom, all in one card. But if I wanted to get some more detail, I can click in and see my denial rates. And now I've got a very similar look to what I had before. So we've got up top here, we can compare things to each other. So I actually have two different locations here. I'm looking at this by facility, as you can see over here in this group by. And I have a hospital and a location. I can see that the MPOWERHealth Hospital 02 is accounting for 97% of my denials. So I probably want to look into that first. What's interesting though, is same sort of thing. I've got my pie chart here. I've got my denial rate by city. It's all interactive. I can click on one of these and everything filters to that same area. But what's interesting here, you'll notice I don't have an area chart because it doesn't really make as much sense to have an area chart for denial rates. But we're tracking the denial rates here by facility. So I can go across and see how they are changing over time. But we have some machine learning, artificial intelligence going on at the bottom here. So I can see here what is influencing my 13-month trailing average denial rate to increase. Now this is going to be correlation, not causality. So what this is a starting point. So I can go in and I can take a look and try to figure out where do I want to direct some attention to see if I can get my denial rates down. So the highest influencer is if the payer is Medicare of Texas, 46% increase in denial rates if that payer is present. I can look through here and see what other things. If the payer type is workers' comp, it increases my likelihood of denieds by 45%. I keep scrolling down here. Keep scrolling down. Now we're getting the CPT codes. So for this particular CPT code, this charge code, 44% increase in denial likelihood if the CPT code is a 72082. But you get some interesting things here as well. So if I scroll down, I can see if the date of service is a Monday, I have an increased likelihood of denial by 34%. And you might be thinking about why might that be? This isn't going to show exactly why that is, but it gives you a place to start. It could be all surgeries are done on Mondays. It could be there's a particular person in your practice on the rev cycle team who is taking care of all the claims that happen for dates of service on Monday. You don't really know, but it's a place to look. It could just be a happenstance of the data, or you're going to find some reason why the data service on Monday results in a 34% increase in denial. But as you can see, between the filters and the first and second level drill downs, this KPI screen, all the slicing and dicing, we literally have scores of reports that we can make available to deliver insights into your practice.